Good morning. I'm Jackie Campbell from Johns Hopkins University School of Nursing. I am delighted to be here. I've been given the wonderful, awesome task of moderating the first panel. And I want to add to what's been said before about the forum. I've been a long-time member of the forum, and that all of the reports are available for free download from the forum website. They are really awesome reports. And this forum meeting will also become a report. And it's really important for those of you in the audience. We depend on you to really give us concrete ideas, ways forward that will become part of the record and will actually become part of the report. So please don't be shy. We're glad that so many of you are here. We wish there were more. This space didn't allow for as many as we would have liked to have gotten registered. We're really glad for those of you that are out there on the webcast, and please send your comments to the forum, to the contact information in the forum also as we go through the discussion. So without further ado, and as is our wont, we don't spend a lot of time on introductions, so I'm just going to say each of the people on the panel, and then they will come up in turn. They have been given very strict time limits. I am confident that they will keep to them. And so our first speaker is Cristina, and I talked to her beforehand. Did I find out the correct pronunciation for sure? It's Bicchieri?
Yes.
All right. From the University of Pennsylvania, just up the pike. Our next speaker, and I have to confess, I've got a scratched contact and I can't read worth baloney. But Rebecca, and I blanked on the last name from Georgetown. Thank you. Lori Heisey, all the way from London School of Tropical Medicine, and Nancy Glass, my colleague and friend, also from Johns Hopkins School of Nursing. How do the clicker, the advancer is right up there.
Okay. So I'm Cristina Bicchieri, and I wanted to alert you that you will find much more content. I sent one of the manuals my consulting group on social norms does. This is a manual for UNICEF, Innocenti Research Center, and we did this for field work on Zimbabwe and Swaziland. So all the concept I'm talking about are here. Is tab 4. Okay. So what I want to do in this really brief time is I want to argue that violence, not all form of violence, but much of the violence we are talking about today, is an angry reaction to violated expectations. So people have certain expectations, not so much individual, but social expectations. Where these expectations come from, they come from well-established scripts about how things are and how they should be, okay? And scripts include shared social norms. So that's where you find social norms in your work. And of course, changing violent behavior requires the ability, A, to understand what the script is and to diagnose and measure the social norm that are part of it. And then, of course, changing the script or changing the expectations that are involved in that particular script. So to understand what do I mean, think you are a driver and you have expectation about how other people drive and how they should drive. So somebody bumps into your car, you get really angry, right? Everybody does. But this anger is due to the fact that this bumper has violated your common, shared, legitimate expectations, okay? So the anger comes with violation of expectations, okay? No more? Oh, okay. So why do these expectations come from? I said common and shared. So they come from what we call schemata and scripts. What are they? It's a little slow. Okay, I will talk of schema because scripts are part of different sort of type of schema. These are our generic knowledge, okay, about everything we do, about social interactions, about roles, about rules we use, etc. And the schema, you can see, affect three very different types of elements. One is our perception, how we perceive a situation, recall what we remember in a situation, inference, causal attribution. Somebody does something to you. You have to interpret, understand what they do. You don't have that much time. You know, you don't sit down and think. It's very, very automatic and is related to the schema you have. The second element, it affects social expectation. What we think is normal to do and what we think is legitimate to do, what people should do. And the third very important effect is on emotions. Because when your expectations are violated, you feel something. You really feel anger, typically. Okay? So, for example, social schemata are shared. These are 80 focus groups of boys and girls. And they were asked questions about what are the characteristics of a good girl. And as you see, especially at the beginning, it's true that, you know, the blue is the girls, the green is the boys, you know, but it's not statistically significant, the difference. And the important thing is that there are certain qualities that both girls and boys think are defining of what a good girl is. And let me see, good behavior is important, being respectful, being obedient, helps at home, and so on and so forth. So there are all these shared ideas of who is a good girl, all these shared expectations. This is just an example of how schemata are shared. Now, scripts are part of schemata. We have schemata for events, sequence of actions. For example, you enter a restaurant, you expect a sequence of behaviors, typically. Okay? And in a traditional society, but also in our society, there are certain expectations about behavior of a good wife. What does a good wife do, right? And look at this. This is what we call a semantic network, okay? What does it mean? That when I prime, this is a, let's say, traditional society, when I prime the idea of a good wife, there are lots of connection with ideas and behaviors that she should perform. For example, she is faithful. Faithfulness is connected to honesty. It is in women, not in men. Okay, a man can be honest but not faithful, but a woman has to be faithful, you know, to be honest. This is very interesting. A good wife, of course, is a woman, and there is a very strong connected network of characteristic, obedient and submissive. For example, I'm talking of a traditional society, of course. Okay, so when you prime the idea of the good wife, all these things get lit up, if you will. Okay, think of a network as like little bulb lighting up, they lit up. Okay, so he's a good cook, he's sexually available, has children and she's caring and therefore is a good mother, and so on and so forth. So there are these ideas, so as we call a semantic network. We can unearth it experimentally very easily, by the way. And the question is, my God, it's terrible. Okay. What happens when these expectations that are part of the semantic network are violated? Okay? First of all, a violation of the script of the good wife will involve a causal attribution. Why she's not doing what she's supposed to do. And unless there are extenuating circumstances, there will be a causal attribution negative. She's rebellious, she's mean, okay, she's disrespects the husband, and so on and so forth. You see, as I said, the script, the schemata involve causal attribution. Very, very important, okay? Now, the legitimate expectation, she should behave like that, has been violated. And by violating the script, of course, she violated the norm. Sorry. And anger is seen as the appropriate response. Punishment is right, is almost a husband duty. And in many societies we're looked at, women themselves say a woman should be punished if she violates these scripted behaviors, okay? So violence, aggression are very much related to the script, in this case, of a good woman, okay? So anger is not, you know, the crazy man who gets angry, is a sort of normal, expected reaction, okay? Oh my God, okay. So what sort of expectation have been violated? One is what we call empirical, you know, what is normally done. So the idea, the men think, all men I know, all men in my reference network, by the way, it's very important to decide who are the people in the reference network, beat their wife if they don't do certain things. And there is a long list, which is part of the semantic network I show you. And there are normative expectations. The man thinks, I say, I think, but also the woman, oh my God, can I have a better one? It's pathetic. What? Okay. So the man says, I think that other men in my reference network think, is the normative expectation. It's not what I should do personally. Maybe they don't agree with that, but they will do it. Because other men think that I should beat my wife if she doesn't cook for me, if she's not a good, you know, housekeeper, good mother, and whatnot. So violating the expectation, okay, means getting angry and punishing the wife. So in domestic violence, abuse may be seen as a proper response to the legitimate expectation, very common, normal expectation that have been violated. This is crucial. Okay, let's come to social norm. I don't have much time, but there is a lot of stuff written here. So if you're interested, you look at that. So a social norm is part of a script. It's a rule of behavior such that people prefer to conform to it if they have the right empirical and normative expectation, what I just described. Everybody in my group does that, and everybody in my group think that I should do that, okay? If I have this expectation, you know, I may have a preference for following the behavior, also because if I violate normative expectation, there might be some sanctions. They may be very mild, they look down on me, they think I'm less of a man, or they may be terrible, like death, in the case of honor norms. It depends. Now, the interesting question that is asked all over is, can we measure norm? My answer is yes, that's what I do all the time. And we measure two things. We measure consensus, so we want to know if there is a norm, if there is consensus within a community that certain behaviors should be there. You know, we should behave in that particular way. And it's very interesting because with this measure, you can distinguish between perceived and objective consensus. Perceived consensus and objective may be different, like in case of pluralistic ignorance. Everybody may think, everybody thinks that wife should be beaten, but in their heart they don't think so, but they do it because they have the wrong idea of what the consensus is. And this is typical of situation where people are put at a disadvantage if they tell everybody what their real opinion are. Okay? So this measure is very important. The second measure is the measure of compliance. Under what sort of condition people would follow this expectation? How would they have causal power on them? And again, we use surveys and vignettes hypotheticals. I prefer vignettes because asking people hypotheticals is really shaky. They are not that able to answer that. So I do vignettes. And basically, like in a lab experiment, I tinker with expectation and see whether people are or would be influenced by that. Or, the particular character in the vignette, I ask you what Mr. Baggi would or wouldn't do in this situation, and how people respond is very relevant. You know what they think. And the last, but not least, is very important, is what we measure. There are lots of things that we need to measure. We measure, of course, behavior. We see what people do. This is easy to measure. Less easy when the behavior is more private, like sexual behavior, but this can be done. You see the consequences. We measure personal normative belief, what the responder believe should be done, my personal belief. And then we measure the normative expectation. We incentivize that. Please, I have interviewed all of you, okay? I give you a prize if you tell me what the majority responded, okay? So I incentivize truthfulness and accuracy. It's very interesting. So it's not just asking you what you think, but I ask you to guess what other people thought. This is part of our measure, and it's very, very important. And the fourth measure is empirical expectation, what people believe other people do normally. And I close here. I think I stayed in my time.
You did.
Thank you.